My name is Sani. I work in microbiology and infectious diseases as a consultant. I'm also the Caldecott Guardian for CUH. The Caldecott Guardian is the person responsible for protecting health and care information, essentially our data as it relates to health, and also making sure that the data is used appropriately in situations where this is warranted. Well, CUH is it's a center of excellence. I work with colleagues that are very professional, very committed, that really like their job. I would say there are a number of reasons why I like CUH. For instance, CUH has a culture of continuous learning. I'm always amazed whenever I go to an MDT, I come out thinking, gosh, I've learned something new today, and that's always nice to know. Over the years, I've also seen colleagues grow and mature and become colleagues really right from their medical students all the way to throughout their training to become consultants. I've also seen departments grow as well and mature. For instance, when I started as a trainee, there were only 4 consultants in microbiology. There are now 10 of us. And in terms of opportunities, people say opportunities come only once in a lifetime, but in CUH there are multiple opportunities to build a career that's strong and fulfilling. You only need to look for those opportunities. They are there provided you're really ready to look. But probably what I value most about working here are the friends, the relationships I've built over the years. With people that essentially have become more or less family. And this is not just my colleagues that I work with, it's also the patients. I have patients that currently attend my clinic that I've been seeing since 2004. So I came to CUH in early 2001. So that gives you an idea of how old I am. I came as a senior house officer, and 6 months later I was appointed to the first joint training post in microbiology and infection. So in a way I was the guinea pig for the training program. Finished in July 2007, went briefly away to Birmingham as a consultant microbiologist, and returned in July 2008 as the first joint consultant in microbiology and infectious diseases. And then in 2015 I was appointed the Caldecott Guardian, so dealing with a lot of information governance issues, etc. And in 2016 I went away briefly abroad to work in Nigeria to help them strengthen their health system, specifically their HIV program, and that in itself was really a great opportunity to put something back into the community that I came from, and to probably save countless lives in the process. Well, every day is different. I work across both the lab side as well as the clinical side. From the lab side, we deal with specimens, we send out reports, we phone colleagues, we harass them about antibiotic prescribing. Well, we don't interfere. I wouldn't say we interfere. We try to improve practice and patient management. From the clinical side, I have a HIV clinic that I do weekly. I also work on the wards for some weeks a year as the infectious disease consultant. And then in between we have the Caldecott issues, which in the last few years have the role has really expanded, partly because of the development we've seen with information technology, artificial intelligence, the fact that we're dealing with a much larger volume of data than we used to. But it's exciting to work here, and I strongly believe that every staff member has something to contribute, and there's something for everybody here in CUH. One of the reasons why I like working in CUH is the multicultural nature of the environment, the fact that we have colleagues coming from all parts of the world, everybody trying his best or her best to contribute to making sure that our patients are managed well and are managed safely. And that inclusiveness is really very critical when it comes to getting the best from our staff.